Hello everyone. Welcome to this series on patient-centered care. This series is based on Patient-Centered Medicine, Transforming the Clinical Method, 4th edition, by Moira Stewart et al. Today's topic is, what is patient-centered care? You might have a general idea, but can you explain specifically what it entails? In this session, we'll explore the definition and historical background of patient-centered care, how it differs from traditional models, and why it's so important. Patient-centered care respects patients' unique feelings and perspectives on their health and illness, and involves patients and healthcare providers collaborating to develop treatment plans. It emerged in the 1980s as a response to the limitations of the traditional disease-focused model, and research has demonstrated its effectiveness. Studies show that practicing patient-centered care increases patient satisfaction and treatment adherence, while also reducing physician burnout and improving job satisfaction. In the traditional medical model, physicians typically led diagnosis and treatment, and patients often took a passive role. In contrast, patient-centered care views patients as active participants in the healthcare team. Stewart et al. Use the word method intentionally. This emphasizes a practical approach rather than just knowledge or theory. Patient-centered care aims to provide individualized care using specific methods. According to Stewart et al., patient-centered care consists of 4 key components. 1. Exploring the illness experience. 2. Understanding the whole person, the individual and their family community context. 3. Finding common ground regarding the problem and its management. 4. Enhancing the patient-physician relationship. How can you apply these components in your clinical rotations starting tomorrow? When observing your attending physicians, pay attention to how they implement these 4 elements. For example, notice how they inquire not just about the patient's symptoms, but also how those symptoms make the patient feel, how they impact their life, and what kind of treatment they hope for. As you engage in dialogue with patients, consider how you can understand their illness experience and life context. Today, we've introduced patient-centered care, discussing its definition, historical context, the significance of the word method, and its 4 key components. Patient-centered care is a collaborative approach between patients and healthcare providers to achieve better health outcomes. In the next session, we'll delve deeper into the first component, exploring the illness experience. Stay tuned.